any obvious redness, swelling, you know, everything feels normal. We're just going to palpate real quickly. I'm going to feel for the apical rub, so that's in the left fifth intercostal space in the midclavicular line, which is right here. And I can feel the apical pulse, which is a normal exam. I'm also going to go ahead and take a listen to her heart sounds and make sure that everything there sounds normal as well. We're going to listen with the bell, the diaphragm and the bell of the stethoscope. All right, so we start off by listening to the aortic area, which is the second right intercostal space. And then we do the pulmonic, which is on the left second intercostal space. Erb's point, which is the third intercostal space. The tricuspid area is the fourth intercostal space. And the mitral area is in the fifth intercostal space, midclavicular line. All right, everything sounds good. I'm just going to check again using the bell, okay? So again, aortic, pulmonic, Erb's point, tricuspid, and mitral. So I am hearing a normal S1, S2 sound. There's no murmurs, clicks, or gallops, so that's a normal heart sound that we're
hearing. Your heart sounds okay. First I'm going to listen with the diaphragm. Listen here for 15 seconds. I'm going to flip it and listen again. I want you to lean kind of to your left side. So normal heart sounds.
Sounds noted. All right, now I'm going to listen to your heart. First, I'm going to listen to the bell. In the first place I'm going to listen to her heart is at the second intercostal space, right sternal border, and that is over the aortic area. All right, now I'm moving to the pulmonic area. That's the second intercostal space, left sternal border. Now I'm moving to the third intercostal space, which is left sternal border, that's Erb's point. Now I'm moving to the fourth intercostal space. Sit up a little bit more, thank you. Fourth intercostal space, left sternal border, and that is the tricuspid area. Then I'm moving to the fifth intercostal space, midclavicular, and that is the point of maximum impulse, or the mitral area, okay? Now I'm gonna turn my stethoscope over and I'm gonna listen with the bell of my stethoscope over these same areas. So this is the aortic, the pulmonic, Erb's point, the tricuspid area, and the mitral area for the point of maximum impulse. Okay, S1 and S2 sounds were noted on auscultation. There were no S3 or S4 sounds present, and there were no murmurs or breathes. All right, Sarah, now I'm
just going to listen to your heart sounds, okay? So when I do that, you can just breathe normally. And this is the aortic, pulmonic, tricuspid,
and I'm able to hear the S1 and S2 notes in all of those regions. If you could lay on your left side for me and kind of pull your shirt up to your bra line. I'm just going to listen to the mitral valve of your heart, which is like right in here. And I'm able to hear it really well right there. Next, I've got to palpate that just to feel the pulsation in that, because it's the point of maximal impulse. I'm just going to palpate with my whole hand because it's easier to find, and I can feel it with my index finger right here underneath. And it is strong and has a good rhythm to it.
You okay? All right, I'm going to be checking your 5 assessment areas. My goodness, sorry. I'm going to be checking, there's 5 of them. There's your aortic area, which is located your second intercostal space, right sternal border over on this side. Then there's the pulmonic area, which is second intercostal space, left sternal border. Your pulmonic area is the second intercostal space. Your third intercostal space is your Erb's point, which is left sternal border. Your tricuspid area is fourth intercostal space, left sternal border. And then your mitral area is fifth intercostal space, midclavicular line. I'm also going to listen to S1 and S2 sounds. S1 is due to the closure of the tricuspid and mitral valves, and S2 is from the aortic and pulmonic valves closing. I'm going to check for systolic and diastolic murmurs. Systolic occurs after S1. Diastolic occurs after S2. And I'd also like to say that if I listened and found anything abnormal during this exam, that I would have you either sit up or move to your left lateral side, which brings the heart closer to the chest. So the first thing I'm going to do is I'm going to be inspecting your chest area. I'm looking for any pulsations. I'm looking for any heaves, any lifts, any vibrations. I'm going to palpate your area, again feeling for pulsations and vibrations. Okay, I'm just going to... Okay, no pain, no tenderness in any of those areas.
No.
Okay, now I'm going to listen with my stethoscope.
Heart sounds. Alright, first I'm going to be listening to your aortic valve, which is the second intercostal space on the right sternal border. Pulmonic valve on the second intercostal space, left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. And right at the apex, the fifth intercostal space, midclavicular line is the mitral valve, which is also the point of maximal impulse. Alright, now I'm going to be listening with my bell. Alright, again, I'll listen to your aortic, pulmonic, Erb's point, tricuspid, and mitral. Very good. And S1 and S2 are present. There is no S3, S4, no murmurs present. All right.
So now I'm going to listen to your heart, okay? First I'll listen here. So I want you to lean over to the left, and I'll listen with the bell. Okay. I'm just gonna have you turn your head side to side. You look at. Make sure you don't have any. Okay.
Right now, just breathe normal, okay? Aortic. Pulmonic. Erb's point. Tricuspid. Way back. And mitral. Okay, now I want you to take it.
So I'm going to find the sternal notch, angle of Louis, second intercostal space on the right side, it's aortic. Okay, sternal notch, angle of Louis, second intercostal space on the left side, pulmonic. Okay, and then down to the third intercostal space, Erb's point. Down to the fourth intercostal space, so the tricuspid. And then down to the fifth intercostal space, midclavicular, so mitral. Okay, S1 and S2 heard. And